Okay, Professor Mai, which
Okay,
equipments are you using today?
it's the popping and the dusting techniques.
？OK，
是左边吗？还是在左边吗？对，we can show this patients because of the ureter
Professor Mai,
stricture.
excuse me,
Yeah,
Professor Mai, we cannot see the video.
你可能 not see the video，
Yeah,
那个图像没有啊，没有图像。
we just see 外科楼16号
对，
，no surgery video.
有吗？wait a minute，
主持
没
老师，
没有the check
主
the
持老师，
machine。
您翻一下页。
是，
主持老师，您翻一下页。
Dr. Yang, can you see the video?
Yeah, I see.
you can
I
see the
think I,
video. Yes,
yeah.
we have found a stone in the lower pole of the kidney, but in the in the CT scan we have found one stone in the lenopelvic. Now we will found the lenopelvic stone. We'll track the
灯光。
scope to see the stone.
The stone is very big for flexible. What is your limit?
The stone is about 2 centimeter. So we
Yeah,
will
yeah,
use the uh scope to follow the stone. You can see the stone?
yeah. We see the stone.
Yes. Professor Liao, do you see
Yeah.
the stone?
Yeah, I can see.
Yes. Oh, now we can use the stereo, use the dusting mode to uh remove the stone. We can see the very hard stone, but the stone we can vaporize it and use the vacuum to suck all the dusting.
What is your setting?
The setting is the 0.3 gel and 100 Hz, about 30 the volt. So we can see the Raykeen, the machine is very useful. The stereo dusting technique can remove, can vaporize the stone very small. So we use the fence techniques very easily to remove all the dusting. We can keep the video is very clean. It's no bleeding.
What is the diameter of the fiber?
The fiber is 260 72 millimeter.
Professor Mai, why don't you use 200 or 150 fiber?
The smaller fiber.
Yeah.
Yeah, because we didn't have the smaller fiber, so we just have 272 unit film. But I think the bigger fiber has more effection than the smaller fiber, because the small fiber vaporize the stone will be more slowly. But we can see the stone is very hard. When the laser eject in the stone, we will have some spider.
It's really very nice because no retropulsion with the suction is very nice.
Yeah, the suction is very effective. I use the single-use ureteroscope is about 77.5 French. So with the fence tube, is 11 French and 30 French. So we didn't need to quickly. We can slowly vaporize the stone, and the kidney pressure is very slow, very low. So we can safe to remove all the stone.
Yeah.
Professor Leo,
Yeah.
what techniques you use in your hospital?
Yeah, I fully agree with you, Professor. I think
Yeah,
match the scope and the sheath is critical for effective negative pressure suction. If
yeah,
the scope is too thick, the space between the scope and the sheath is too narrow. Maybe
yeah,
it will lead to poor backflow and higher renal pelvic pressure. So it's dangerous. So I think the balance is extremely important. In our hospital, we always choose 7.5 French single-use flexible ureteroscopy with 11 or 10 French fast. If we use 6.5 French scopy, we will choose 10 French sheets. Maybe I think in this situation, maybe it's more effective and more safe.
yes. Which power you use or which laser you use, Professor Leming?
Helium or Cilium?
Helium, helium.
Yeah.
Which one you like
We
better?
always use helium.
Helium.
Sometimes use Thelium.
Helium.
Yeah.
Okay.
I always
How about in
use
Yang?
I
Uh,
use holmium.
Helium?
Helium.
Holmium, yes.
Yeah.
I don't have experience in using thulium. I use holmium.
Uh,
But I think in this situation, helium will be more easier than the helium. What do you think, Neil? Professor Neil?
Um, uh, for me, all the laser are very nice. I don't have enough experience in thulium, but I'm very happy with
Yeah,
holmium.
yeah. Uh, which
But
situation you use the dusting or popcorn techniques? Yeah, you
I
use
use
in the helium.
I start dusting, and
Yeah,
it's a big stone. I
yeah,
do popcorning, you know. But it's
yeah,
nice here because you don't have any retropulsion. I think
yeah,
yeah, in thulium, not many retropulsion, and it's very nice.
yeah. Uh, do you use fence techniques or
I I
the
use
fence technique?
sometimes, but I
Uh,
use sometimes, but it's not usual. I start only fans now, but
yeah,
usually I don't use the fans technique. I use normal access sheet.
yes.
Yeah, without fans.
As we know, use the horizon. We need to check the scope very frequently. The doctor will be very tired when we meet the big stone in the stone in the kidney. So you can see we use the senior. We didn't need to check the scope. That's made me comfortable more than use the horizon. What about you, Professor Leo?
I think helium and cilium are both very good for lithotripsy. Uh,
Yeah,
because I think sometimes we use psyllium because the inflammation is very severe in the pelvis. In this
yeah,
situation, the mucosa maybe
yeah,
be more edema. In this situation,
Yeah.
we use psyllium. It can reduce the bleeding of the mucosa. So
Yeah.
I think in this situation, psyllium is more effective. But in other situation, because just like the stone is in the lower pore, and our ureteroscopy can not get the stone position. Maybe we will use psyllium to shock the stone. Then
Yeah.
we can take this stone out of the lower pore.
Yeah. Which energy you like use? 30, 20, or 40?
We will use in helium, we use
Yeah.
20 to 30
Yeah.
watts.
Yeah.
In psyllium, we always use 20 to 25.
Yeah. The water, the liquid, how much you use? The liquid, 200, or the infiltration liquid, 200 millimeter per minute, or 100.
100, yeah, 100.
100.
Yeah.
Yeah. But I like 200. So the powder will, yeah.
It's more bigger.
Yeah.
I think
But yeah.
100 or 200 maybe it's okay, because
Yeah.
we now it's fast era, because
Yeah.
we can use the suction, the infusion, uh, fluid maybe it's not very important.
Yeah. How about you, Professor Nyaja?
Yes, 100. I avoid to use very, very higher irrigation because it's very painful for patients sometimes,
Yeah.
even if you section.
Yes.
And you see, for me, the stone is very big. And how many time it takes here for you?
What? One time?
The no, how
One
many,
step?
for you? How many time? 1 hour, one
Uh,
hour?
yeah. If you uh, do the more quickly, 1 hour we will finish the surgery.
Mm.
Because I slowly to fact dusting the stone, so we can see is the filler is
Yeah,
the more effective. You can see the stone is very hard. You can see.
yeah, yeah.
Yes.
That's why sometimes in very hard stone, the holmium may be better and faster. It's my opinion.
Yeah.
But this situation is very common in China. In China's
Yeah.
patients, the stone is more hard than in
Even in
your
my country,
hospital.
the stone, even in my country in Senegal, the stone is very hard. I think in West
Yeah.
Africa, those stone are very hard. I don't know why, but we have
Yeah.
more monohydrate stones.
Uh,
But
ordinarily,
but
in your hospital, the composition of your hospital, the patient's the stone is the what kind of composition?
we have oxalate
Also like, yeah,
monohydrate, monohydrate,
yeah,
very very
normal
hard
hydrate.
stone. We have more monohydrate, yeah.
How about you, Professor Leo? Your hospital?
Mhm.
Yeah. In your hospital, which composition is more common?
Calcium stone, maybe.
Yeah. Yeah. You can see the stone is in the lower pole of the kidney. In the CT
Yeah.
scan, we can see that
Yeah,
it's
it's
very
too
low.
high.
yeah. So in the beginning, we can slowly fragmentation dusting, but in the end, maybe we need some popcorn technique
Fragmentation.
to fragmentation. Yes.
I think
Yeah.
so.
How about this kind of lower pole kidney stone free rate? You use the fence techniques, Professor Liao?
In the
The stone free, yeah,
if the stone in the lower pole, I think we should choose the technique according to the IPA angle.
yeah,
Because if the face and the scope can get into the lower pole, it's easy. We can dusting or fragmentation the stone and suction the stone fragments. If
yeah,
the fence and the fence cannot get into the lower pole, maybe we will use the Scorpy
yeah,
get into the lower pole and put the fence and the calyx of the lower pole. Then we
yeah,
use suction and with and the laser, the shocking of the laser to move the stone. Then maybe we can take the stone out of the lower pole.
yeah. How about you, Professor Ninja?
Yeah, for me, in this case, I think it's a very challenging case because it's big and in a low pole. Maybe
Yeah,
if it was me, I will do PCNL because it's big.
yeah,
Uh, if not, yes, I will go fragmenting in the lower pole and remove the fragment with basket from the lower pole.
yeah,
Otherwise, it can take many times in the lower pole.
yeah. But the patient is BMI is the 31.
Okay.
The tunnel
Oh,
distance is about 14
okay.
centimeter. So the patient use the PCNL technique maybe more challenging.
Exactly,
Uh,
exactly. If
yeah,
he's
yeah, yeah,
BMI,
yeah,
exactly. Yeah, yeah, yeah.
yes,
Yes, fan
uh,
technique is here very nice,
yeah. But I think fence
but I
technique is
but I think in the lower pole, when you are in the lower pole, it's better to do fragmentation or popcorning
yes.
to be faster. Yeah.
Popcorn technique. Oh, okay. I will change it. Popcorn techniques. Okay. Uh, popcorn technique. Yes, this is popcorn technique of the senior laser. Yeah. Uh,
Yeah.
Professor
yeah.
Yeah.
Wang.
It's
Okay.
yeah.
We will say received a question from the audience.
Yeah.
Is this one stage or two stage procedure? And was
One stage.
uterus placed in advance?
I usually you will use one stage fence techniques to do the this certainly. I think we can have three times the tube fence technique. It's 20 11 French and 12 French and 10 French. So if we meet patient has ureter stricture, we will change in the use the smaller tube or use the tubeless techniques to do the surgery.
Mm-hmm.
And then I think if this patient has a history of the ureter stricture, so I choose the 11 French. So
Mm.
you can see the tube is very easy to put into the into the kidney. You can see if the stone we cannot use the scope to reach it, so we use the tube to help me to optimize the stone. This is also one technique.
Yeah, amazing. It's a good
Yeah.
technique.
Yes.
Yeah, sometimes
Uh,
we
the,
use the fast to move the stone.
yes.
Maybe it's very helpful.
Yeah. So we use dusting techniques is more slowly, but the stone will be more small. But we use the popcorn techniques. The fragmentation will be more bigger. We need
Yeah,
some
yeah,
time to remove the fragmentation. But all these techniques is useful.
Yeah.
yeah. But it's faster now, I think.
What?
With fragmentation, you see here, you have more fragment now
Yeah.
Yes.
when
So we
when
need
you change the
to
mode.
check the
Yeah,
scope to remove the fragmentation.
yeah,
Yeah.
and it's nice with the fans. Even big
Yes.
fragment, you can section
Yes.
even big fragments.
Yes. This is the advantage of the senior laser. All the procedure will do in a lower pressure, so we can safely to use these techniques.
Yeah.
Do you use the
But
safety wire or not?
what?
Safety wire.
Safety wire? Yeah, no, we don't need safety wire. You can see we
Yeah, yeah.
just yeah.
There's no wire.
No, no, outside the access sheet, no.
No. In
We
China,
didn't need a safety wire.
yeah.
Yes.
Yeah, Dr. Yang, in China, now
Yeah.
we don't use safety wire.
Okay.
Just
We,
only use one wire. In some
Yeah, yeah.
situation, we will use two wires.
Mm,
Just like impacted stones. In
yeah.
this situation, we may use two wires.
Okay. For you, what is the best laser for flexible ureteroscope? Thulium
Mhm.
or holmium for your experience?
Excuse
yeah,
me?
we use Hollywood laser. Do you use
Uh,
Hollywood laser, Professor Liao?
yeah, I use
Which
volume, volume.
which powder
Which
you use?
one is which one is better for you?
I
No, I say in flexible ureteroscopy.
It's a good question. I think
Mm,
Helium and Helium is also a good equipment for us to lithotripsy. The Cilium is also very good. I think the difference between Helium and the Cilium is not very big. I think sometimes the effective is more is worse is thing.
mm,
Professor Naja, my opinion is we need two kind of laser. So we will our operation room we have two laser. One is holmium, the other is the pinion.
Yeah,
So yeah, yeah. When you need this holmium, we will use the holmium. When you need the pinion, we will use the pinion.
yeah.
Yeah.
So sometimes
but but but
we
but
change
you know,
the laser in the surgery.
you can change during the surgery. You can change the laser.
Yeah, because
You know me.
if the pelvis is bleeding, maybe we change the helium to cilium.
Okay, but but in Africa, all our department We can't sometimes have two lasers in the OR. We
Yeah.
have to choose only one.
Yes.
It's
Yes.
it's a difficult,
So
yeah, it's a difficult choice, I know.
yes.
It's better to have both. Yeah.
Maybe next time we will have one machine have two kind of laser. It's the whole plus three laser maybe better. That's like the double star machine of the uh two tunnel. Is one is laser whole laser, one is linear laser. I think that will be better. What do you think, Professor Leos?
Hmm?
You, we can see if you the mucosal
Yeah.
so why we use the serial when the mucosal injured
Yeah.
there
Yeah.
will
Yeah.
no bleeding. If you
Yeah.
use the whole laser, maybe it will bleeding in the second suction.
Yeah. We can see
Yeah.
the
Yes.
injury of the mucosa, but there's
Yes.
no bleeding. This is
Yes.
the advantage of the psyllium.
Okay.
Yes. Yes. Because the
How
lower
many?
power kidney stone will have this situation. This situation is very common.
What is your
Mm.
maximum time for flexible? 1 hour, 1 hour 30, or to go to
Maybe
second stage?
we maybe in the advanced techniques is the
Yeah.
2 hour or 3 hour. We didn't need
Le-
control the operation time.
okay, 2 hour lasering time, 2 hour.
About 2 hours. We have the biggest stone we have you use the fast techniques is 4 centimeter or more. We
Yeah.
use we in the operation we have 2 3 hour or 4 hour, but I think it's
I-
a challenge for the patient and the
yeah,
doctor. Yes.
you don't have many infection if you stay so longer in the kidney, even in fast technique.
Uh, because we the kidney is in the low pressure procedure, so the kidney function is normal.
Mm-hmm.
But I think this is uh not usually because the patient is the change. He didn't want to do the personnel surgery, so we use the fence technique. And after the 4 or 3 hours operation, we didn't clean all the stone. We needed two-step surgery. So
Yeah.
it is very very challenging.
Yeah. So I think the intrapelvic pressure is the key.
Yeah.
If you can keep the intrapelvic pressure is lower, maybe you can prolong the time of the surgery, just like 2 or 3 hours.
Uh, the
Professor,
most
Professor Mai,
yeah
some
yeah
audience let you show the parameters of the machine.
heritage
Raykeen
yeah.
Psyllium machine.
So after the operation, we will show you the machine. I,
Uh-huh.
we can how can we see the machine in a take off photo?
They
Uh,
can move the
yes,
camera to show
move the
the
camera
yeah to
machine.
show the machine.
Okay,
They want to know the parameters of that you
okay,
choose.
okay. That machine. This you can see the machine. Yes, yes. Okay. This is the machine, and this is the you can see
Yeah.
30 volt. You can see, and the pumping
Mm-hmm.
is 200. You can
Yeah.
see.
Yeah.
Yes. And the fence technique we use the 主动的嘛，主动可玩翘。So we didn't use
Maybe.
it. Yes. So I think the 200 millimeter per minute is the safe. We may use the fence techniques. We can see the inside the region of the. We can use the tube to help me control the stone. But it need more time in the lower pole of the to remove the lower pole kidney stone. And the stone is too hard, so I think this certainly is a challenge for fence technique or the risk operation.
Yeah.
If you in this situation we use the only we will make much better. We can fragmentation the stone more quickly.
Yeah.
But
Yes.
Professor Ma, if
yeah.
you don't use the water intelligence pump, you cannot control the intrapelvic pressure.
Yes.
Just use traditional fence.
Yes.
How do you balance the infusion and the intrapelvis pressure?
It is a good question. In this situation, the first important thing is the put the tube, urethral tube into the nanopelvics. This is first things. If we didn't put the urethral shut into the pelvic, the irrigation and the water circulation will have no effect. So the control of the pelvic pressure is very difficult. You need to calculate how much water you put into the renal pelvic and how much you can putting out of the renal pelvic. So if in the two situations, if my uterus shot put into the renal pelvic, we can easily control the renal pelvic pressure, so we didn't need to control the water. But if we can put the cell into the renal pelvic or under the UPJ, we need the control the time of operation. Maybe I think 90 minutes is very dangerous. It just this operation time will control in 30 minutes or much less. If we cannot remove the stone, we will put a ureter stent into the pelvic and do the second type operation. This is my opinion.
Yeah, I fully agree with you. How about you,
Yes.
Professor Nyang?
Yes, I'm totally agree. I think if you don't have funds, you have to you have to limit your laser
suction
time.
fracture.
And
没有 suction fracture，
one
是那个
hour
墙壁
session
那个
is
墙壁的
is
那个负
maximum.
压是吧？墙壁负压多少？The suction pressure, some doctor ask, the suction pressure is the we can see. 0.4 1000帕怎么说 ？Kilopascal.
Kilopascal.
Kilopascal, yeah. is the central suction pressure. No, in our machine. Right, Professor Liao, what do you think about the pressure control shot or the pressure control scope?
What? Excuse me?
Pressure control shot, filter shot, pressure control, or the pressure control scope.
Power control.
Pressure, 压力。
What is your pressure
Pressure
control?
control. Yeah.
Pressure control.
Yeah.
Pressure control. Yeah. If we cannot control the intrapelvic pressure by machine, just according to our experience, I think the collapse of the pelvis is very important. If the pelvis is not is not like the balloon, it's with some collapsed.
Dilate.
Yeah, maybe I think it's the intrapelvic pressure is lower. But if just like a balloon, maybe the intrapelvic pressure is higher. So we balance the irrigation and the suction to keep the pelvis collapsed a little. Not completely collapsed, because if the pelvis is completely collapsed, there's no space for us to fragment the stone. This is my opinion.
Okay, thank you. How about you, Professor?
I think the key
Leon?
is to control the irrigation. If you don't have pressure, don't put higher pressure in the irrigation, I think. Because it's difficult sometimes to know how is the pressure if you don't measure it. You have to control your irrigation. I don't know, because in some areas we don't have pump. We sometimes
Yeah.
we can have some kind of
So which line of irrigation mode you like? Hand or pump?
We don't have pump, always pump. We sometimes have pump.
Yeah.
Not pump, not the machine. In the irrigation, you see, yeah. Like T-flow.
Yeah, deep flow.
Yeah, we have T-flow. And sometimes we put more pressure in the pelvic. That's why I think it's important to limit your laser time in 1 hour 30 maximum. Never 2 hours. Yeah.
Maybe. Yes. You're right. But we use pump commonly now.
Yeah.
So it must be much safe than use
now I have pump, but it's only two months ago I have the pump, the machine pump.
Which model you use?
Yeah. But I know it's very nice to have the pump, because you can control the pressure. You have irrigation and you have section. It's really more safe.
Yes.
Professor Mai.
Yeah.
During stone suction, how do you effectively solve the problem of stone retropulsion?
Stone retropulsion?
Stone retropulsion?
Yeah, because we need, you can see, we will fragment it in more smaller first. The second is we can fragment the stone in the uterus shot. It's it's more maybe or certainly more easily.
There is some charts, I think, but we don't see.
What?
Do you see, Professor Lai, discussion, some questions in the audience?
In 他说 the question.
Professor Lai, do you see it? No.
Yeah. 邓田，那个 Nadia 说什么？听不清楚。
How long the fiber you set? This is a question from some audience.
How long the fiber is
Yeah.
in the scope, or you use the fiber?
It's 1 use or 10 use fiber?
Single use.
Single use
1
fiber?
use. Yes,
Yeah.
single use fiber.
In all your case, you use one single use the fiber, or you have some fibers, reusable fibers?
This 他说啥意思？那个邓婷婷呢 ？Fiber is the when we finish the operation, we'll but in some hospital we use the multiple use fiber. In our hospital we use the single use fiber. It's if the fiber but commonly this fiber can use many times. But sometimes if you use the more power energy or over 40 volt, maybe one time the fiber will be you cannot you damage it.
Yeah.
So if you lower power, the fiber can use more time. But use high power, the fiber you very easily damage it.
Yeah.
But in this kind of hard stone, we need more power. So the fiber will be very easy to damage. It's the single use.
Yeah. In our hospital, we use multiple use laser fiber. There's no
You may use
single use
multiple.
fiber.
Yes.
It's more expensive for the
Yeah.
patients.
Yes.
There is another question. What is the suction pressure? I think you answered the question.
Suction pressure is 0.4 kilo pep. 什么？Yes.
您回答过了。
We'll meet a much difficult section of the operation. So we use the tube to hold the stone, so we can vapor the stone slowly. But stone is too hard, so you can see the laser cannot easily to dusting it. So we just need to fragment it. The 30 watt is the very high power.
Professor Mai.
Yeah.
In this situation now, maybe I
Yeah.
think put the scope out of the tip of the face, just fragmentate the stone. Maybe
Okay.
I think
Okay.
maybe it's more effective.
So yeah, but I need the tube to help me hold the stone. But now
Yeah.
the stone can much easier to fragment it. So we can retract the tube
Yeah.
under the UPJ. But we can see the when we check the tube out under the UPJ, the scope is not long enough.
Yeah.
The tube is too long.
What is the size? What is the size of the
The
accession of the
size.
fan? The length of the
It's the 55吧，45 or 55 centimeter 50不
55.
不是这个 tube 是55嘛
55.
55
55.
yes
55,
55
yeah.
centimeter yes but the
55 is
patient is too
long.
tall he's very tall
Yeah. Because 55 is long,
yes
yeah.
yeah but the patient is
Is very,
189 centimeter is very tall
okay.
This stone is too hard.
It's too
yes
hard and big, that's why.
Yeah.
Yeah, it's too hard. It's a
So,
very challenging case.
maybe we
and
can change the whole laser to dust popcorn
Yeah.
换个火激光
Fragment.
换个火激光 we'll change the whole laser to see which laser is better. So we think we need the two laser. We've changed the laser for laser. So I think the Raykeen has two kind of laser. We can help doctors to solve the situation.
Yeah. Raykeen has
Yeah.
thulium and holmium.
Yes.
We also change the equipment from Raykeen holmium to Raykeen thulium, or from Raykeen thulium to Raykeen holmium.
换了吗？It's used the same fiber, so we can change the machine.
You put your WG stent after all your surgery, or some cases you don't stent?
The stent we didn't need it before the operation. It's just one stage operation.
Yeah. But after the operation?
Yeah. After operation, we will put a stent for about 1 month, because the big stone patient, maybe we cannot remove all the stone. Maybe some fragmentation will drop into the urethra. So we need to use the.
Yeah, this patient has
but in all your
construction history.
Yes.
I'm agree. This patient need a stent after, but for all your cases you put stent, or there is some cases you don't put stent after surgery?
Sometimes we don't put the stent. just like because the stone is small and the time of surgery is short and the ureter is very good. In this situation and without infection. In
1.525。
this situation, maybe we don't put the stent after surgery. How about you, Professor Mai?
May I have pardon? I just changed the fiber, so we didn't hear.
Which patient you do not put stent after surgery?
Yeah, the patients have the more have because before the operation, if you put a stent more than 2 weeks, we will consider not to put a stent after the operation. And second time is the patient have the bigger ureter, such as have passed the stone before, and the stone is more small. We will not put the stent. But I think it has the situation about 10 patient of one patient with 10 per 1 per 10 patient will not put a stent now.
Okay.
The single aided stone, or small stone, or the second surgery stone, we maybe do not put a stent, or put 3 days. Maybe I think 3 days is more safe.
Yeah.
Yeah.
How about you, Professor Liao?
In our hospital, just 10% patients we don't put the stent after surgery. Just like you, some patients we put the stent for 1 to 3 days.
Yeah. How can which method you remove the stent? The ureteroscope or
we use the ureteroscope or single use or multiple use flexible cystoscopy.
Professor Liao, you can see the stone is the structure on the mucosa.
Yeah.
So
yeah. It's the
RIRS is much better than Xenium. You can see?
Yeah.
Yes.
Yes. In this situation, we use Psyllium. It's more safe.
Yes. Yeah.
There's no bleeding.
Yes. But a decent stone is use the RIRS is much better.
Yeah.
The popcorn power is more bigger than the Xenium laser.
Yeah. Professor Ma.
Yeah.
If this patient without the higher BMI,
Yes.
now need to choose the treatment, PCN or RIRS.
Yes. But fans also is what the other treating method.
Yeah.
Do you use sometimes a combined technique?
Yes. Yeah. Combined technique. Yes. The PCL and the RIRS. But the patients is the more fit for PCL.
If the stone is more complex, only one technique cannot solve the problem. We will combine the PSN and RES to solve the problem.
Yes. But we almost finished the operation.
Yeah.
the patient have long history of the kidney stone. It just and maybe the stone is the last time personnel did not finish the operation last time personnel in other hospital. So the stone is sticking in the mucosa.
Yeah, I totally agree with you.
Yes. How often you meet this situation, Professor Liao? How often you meet this situation?
It's a lot more, just only a few patients, maybe. Because in our hospital, the complex stone is not more than 5 years ago.
Yeah.
Go.
We are just have 5 minutes to talk.
Yeah.
Yeah. Yes.
Yeah.
The most important things is here.
Yeah.
The highlight of the operation is here. The whole layer to popcorn the stone in the mucosa. And the bleeding situation.
Yeah.
Ah. 没有 single stage. Some patient, some doctor ask me, before the operation, did I put the stent? We are used the one stage operation.
The suction works very, very well. It's very nice.
Yeah.
It's a difficult fence operation. Not the easy.
What is the suction pressure? The
Suction pressure
in the
suction pressure is the 0.4 kilogram.
How?
0.4. So we use you can see the tail we will the 主动是吧？主动可玩效。
Yeah.
Yeah, steerable. Bending tube. It help me to treatment this kind of the stone. We need a scope to bend. We use the tube bend. You can see? The steerable tube, bending tube, is a Professor Zheng have some paper to say this kind of tube is we can down you can see? We can down the tube.
Yeah. Yes. the active deflectable axis sheets can free
Yes,
our
yes.
hands.
Yeah, can free our hand and help me to straighten this kind of stone. We needn't
Yeah.
bending the scope, so
Yeah.
we'll more air to treat it.
Yeah. You just fix the sheets in the position of the stone. Just
Yes.
just
Yes.
control the ureteroscopy.
Yes.
Maybe it's especially helpful for the narrow stones.
Yes. Ah. Thank you, Professor Leo. Thank you, Professor Naja. After 1 minute, we'll change other operation. And thank you for all the supporting team and the Raykeen company and all the professor in the line to help me to finish this operation. Thank you very much.
Okay, thank you. Congratulations, Professor Mai.
Thank you. Thank you.
Congratulations, very nice demonstration. Big
It's
stone,
amazing surgery.
very hard stone, low cone, very
Yeah.
challenging case, but well done.
Yeah.
Thank you. Thank you.
Yeah. Dr. Yang, nice to
Yeah,
meet you.
yeah.
Welcome you to
Nice to meet you
China.
too. It was very nice. Thank you so much.
Okay. Okay.
See you next time in China.
See you.
Yeah.
See you.